Welcome to Stoughton Health Talk. I'm your host, Maggie McKay. Today we'll discuss in-home care with Executive Director of Village Caregiving, Madison, Leslie Luedtke. Thank you so much for joining us, Leslie.
Thanks for having me today.
What are the benefits of choosing in-home care?
Well, keeping the clients at home, they're very familiar with their surroundings, which can also reduce the stress when somebody new is entering the home, like the caregiver. So it is really important just to keep it calm for the client and be consistent and personal as well. So being in their homes, it just creates for a better normal routine that they are used to. It also can promote longevity, especially with their memory, just keeping the independence going. It is definitely very helpful for anybody that does have in-home care, just to keep themselves independent and their mind and brain working properly. They also will have extra support from family members. So if they're living nearby, they're able to have that extra support with the caregiver. If something by chance were to happen, they have extra family members there and nearby as well. With in-home care, they also offer a lot more flexible schedules as well. So being able to build that relationship with your caregiver and having that steady communication is also very important.
Leslie, when we talk about in-home care, what age group are we talking about?
It is really anybody that needs that extra assistance in the home. So I've seen clients in their homes ranging from 35 to 75 years old. So it really is anybody that just needs that extra assistance, and it can branch off of really anything. It could be just a short-term little bit of rehab that they need the extra assistance in the homes, or it could be 24/7 that they just really need somebody there by their sides at that time.
So what should you look for in a quality home care provider?
Having direct communication with the office staff is very key. Looking for that person that has the 24/7 hour line that is available to answer any questions that you might have. Also, the caregivers need to be properly trained and have that continuing education offered to them as well. And then also including with the caregivers, a proper background check that is also complete every 4 years with the state of Wisconsin. Having an RN in the office to complete those in-home assessments is very important. To continue to do those every 6 months too, to make sure that any changes in the health is documented.
What questions should we ask during a home care consultation? Because I'm sure there's a lot to know that maybe we wouldn't think of in the moment.
Yeah, reviewing the service agreement with the agency that you are working with is very important. There are a lot of bits and pieces in there that are very relevant for a client to review. And then also asking more of the caregiver type questions. What if something happens? And what if the caregiver doesn't show up or they're not doing the proper scope of work during their visits? And then just creating the game plan for when those types of situations do arise. Also with the contract, do you bill for assessments or plan of cares? Those types of questions are also very important. And then including that, if you are doing an RN assessment or a plan of care, does the hourly rate change? Do you have a minimum for the hourly rate as well? And then what insurances could be added as a supplement instead of doing private pay?
Speaking of insurance, how does insurance or Medicare factor into home care decisions?
It really does come down to the family's preferences and needs. There are a lot of different insurance programs, long-term, short-term. It kind of depends on the plan of care too and what the assessment does show. A lot of agencies also work very closely with the VA. And so when you do have those VA benefits, they guide you on where to go and what to use. And as far as if they don't have any insurance, we are able to connect with aging and disability resource centers. And they usually have the right guidance for that specific need or want from that family.
You brought up a good point earlier about when you have to ask these questions, cost. What are the costs associated with home care and how can families plan for them? Because I understand it's pretty expensive.
Yeah. From my point of view, when I have done my research, it does range from about $35 an hour to $78, $79 an hour. It does depend again on what type of things need to be done in the home. So when it comes to the home health portions of it, they are looking at extra expenses like the shower chairs or the shower handles. So those types of things also need to be prepped into the home, as well as thinking about the cost of the hourly rate too. And so again, coming into the play of using your long-term insurance appropriately. And if you do not know where to go, who can you ask and where can you go for extra help and assistance? So even though we don't have necessarily all the answers right off the bat, we are definitely able to help assess and guide the families and get them to the right place.
And what types of services are typically offered? How do you know which ones are needed?
After the in-home assessment, we are able to kind of sit there and chat with them about what does need to be in the home and what their primary focus is while a caregiver is there. It is typically daily activities that they aren't able to do by themselves. So bathing, extra assistance, or even standby assistance. We do also do sponge baths too. And after the bathing portions of it, it is the dressing, the grooming, the shaving, light housekeeping duties that they aren't able to do, and then companionship or transportation. So it really can range for any aspect with the in-home health assistance.
Well, it sounds like you've got it all covered and have thought of everything. This has been so informative. I've already learned a lot. Thank you so much for joining us and sharing your expertise.
Thank you for having me this morning.
Again, that's Leslie Luedtke. To listen to more Stoughton Health podcasts, please go to stoughtonhealth.com. And if you found this podcast helpful, please share it on your social channels. I'm Maggie McKay. Thanks for listening to Stoughton Health Talk from Stoughton Health.